March is Endometriosis Awareness Month, and awareness is so very important because the disease can be difficult to understand. And when it comes to us women, being an advocate for our own care and expressing our symptoms can also be difficult. That is why someone we know as an actress, dancer, and Emmy Award-winning choreographer is opening up about her story to encourage others not to suffer in silence. Welcome Julianne Hough and Dr. Rebecca Brightman. Ladies, thank you so much for joining me to talk about this important information.
Thank you for having us.
Thank you.
Well, Julianne, before we get to your personal journey, Doctor, I want to do a little bit of education right off the top and talk about what is endometriosis and some of those symptoms I was talking about.
Sure. So endometriosis is actually one of the most common gynecologic conditions affecting 1 in 10 American women. And the symptoms of endometriosis really are severe pain, menstrual pain, pain sometimes at different times of one's cycle, sometimes pain during sex, painful urination. And the reason why people have these symptoms is because in the situation of when people have the condition endometriosis, they actually have the presence of small pieces of tissue, which we refer to as implants. And these implants are very similar in appearance to what we see in the uterine lining. And these implants undergo inflammatory change and can result in severe pain for women at different times in their cycles. And it's not part of being a woman. It's the severity that is what determines whether or not someone can have this disease.
And why is it that we're doing this education? Because it is hard to diagnose. Why is that?
Well, it can take on average 6 to 10 years before a diagnosis is reached because so many of the symptoms are really chalked up to being a woman. Women have painful periods. Sometimes women need to stay home. That's not normal. If these symptoms really are at such an extreme that they interfere with work and social activities and they're debilitating, women need to speak out. They need to get more information. And this campaign, Speak Endo, is really important. Women can get more information at speakendo.com to determine maybe they have endometriosis, and if so, they need to raise their concerns with their healthcare provider.
And Julianne, when we're talking about speaking out, that's kind of exactly what you're doing. Can you kind of tell me about your story?
Absolutely. I had endometriosis probably since I was 16 years old, but I didn't get a proper diagnosis until I was about 20. And for me, it was the same thing. I didn't want to complain. I didn't want to be, that person. I was a tough cookie. I'm a dancer. I'm hardworking. I'm not a complainer. So, for me, it was like I just, keep my mouth quiet. I'll deal with it on my own. But at the end of the day, it was so painful, and it is painful. I still, live with it today and have it as a part of my life. But it's something that has empowered me, knowing that I have a name to the pain and that it's not defining who I am, that I have, I'm in charge, basically. And because I have a knowledge and an understanding of what it is, I feel like it is my responsibility to speak up so that other women, because 1 in 10 women have endometriosis and probably don't even realize they have it. And so I want to be able to speak up so that they feel that they can speak up. So, when we're talking about our campaign, Speak Endo, we want people to use the hashtag, tell their stories, build the community of support. I mean, this is an incredible community. I have fans, but also people that aren't necessarily my fans, but that are, contacting me on social media, just really, basically saying thank you for speaking up, because now, they have got a proper diagnosis after, 6 to 10 years, or their family members know about what endometriosis is. So it's been a very, very fulfilling thing to be able to speak up.
Well, I want to thank you, just as you said others have, because you're right. Our voice definitely has some empowerment behind it. So make sure we use that. Jump on this campaign, and this is the right month to do that. Ladies, thank you so much for talking to me about this.
Thank you.
Thank you.
Don't go anywhere. The Morning Blend. We'll be right back.